Hey guys, how you doing? My name is Casey Miller. I am a physical therapist and registered dietitian at FYZICAL in Rockville, Maryland. Today I wanted to share with you 4 different products that you can use at home to help improve and reduce pain, improve range of motion, decrease tissue tension, and get yourselves feeling better and moving better, hopefully. Okay. These products are from Hyperice, and the first one is a vibrating foam roller. Okay, so this is called Viper 2.0. It's a pretty sweet tool, all right? And it's a foam roller, okay, but it also vibrates, so it'll help reduce pain, improve blood flow to a tight muscle that you might have. So you use this like a regular foam roller, but as it's foam rolling, it's vibrating as well. I like this one because it has a pretty thick diameter. It's gonna make it a little bit easier to roll on, okay? So what you do is you turn it on, and there's 3 different levels, 1, 2, and 3. I recommend starting with level 1, okay? And if that's not too much pressure, you can advance to level 2 and advance to level 3. So it's patient preference and it's what you can tolerate. So we turn it on, get the little button going, and it starts vibrating, okay? So you can foam roll any muscle that you have, okay? So thoracic spine, you can get into the lats, quads, hamstrings, calves, you know, tibialis anterior, even kind of work in the chest a little bit. So I'm going to show you today just how to foam roll your thoracic spine, because that's usually pretty tight on people as we're working throughout the day. So we turn it on, it'll start moving, all right? And we're just going to put our mid back on here, rolling back and forth. We can also working on some breathing techniques. As we're rolling, okay? So, nice little tool that you can use at home. Just want to turn it off here. But it'll help reduce pain, improve blood flow, and reduce tight muscles. So it's a great tool to use. Foam rolling on the floor. You can even use it up against the back of a couch to get some of that mid back as well. Or you could do sitting in a chair, turning it on, and then just kind of rolling your quads. You can even work on your calves too. So it's a nice little tool from Hyperice. The second product that we've been using at FYZICAL through Hyperice is called Venom, and it's a back support, okay, but it vibrates and heats up as well. So there's 4 little prongs on the back, and then what you do with this is you'll wrap it around your low back. And then from here, if we hold this little red button, turns on, all right? And we have 3 different settings on this one as well, okay? The heat, we have low, medium, and high. So that's patient preference of what feels good to you, okay? So if you like a little bit of heat, I'd say level 1 would be where you need to be, all right? And it does vibrate, and there's 3 different modes. There's a wave, pulse, okay, and constant. And for this, it's still patient preference. So the wave kind of vibrates in and out. The pulse goes kind of more of like a circular type motion, and then constant, it's vibrating the whole time. So I've been using on this on individuals who are having some low back discomfort, whether they're stretching their back out or they're warming up on a bike. We've been using this and they've been feeling pretty good with it. Also, if individuals doing push-ups, so there's a lot of exercises that you can do. You know, if you are having a low back problem, it's harder to maybe do some core exercises in supine, so laying on your back, just because these little prongs here. But you can certainly do standing core exercises, anti-rotations with this on to give you a little bit of some comfort while you're going through your exercises. So it's been a nice little tool to help reduce some stiffness and tightness in through the low back, and you can still exercise while you're wearing it. So that's been the benefit with this, whether you're doing core exercises or you're going through your warm-up. So that's product number 2. Pretty nice, pretty sweet design. All right, and then product number 3, we have a mini and a little bit bigger, okay? So these are Hyperspheres, and they are little vibrating balls which will help reduce pain. It's a nice little tool. There's 3 different modes. There's level 1, 2, and 3, okay? So this is nice, it can travel with you, but I'll use the mini here, and what you can do is if you turn it on, you have to hold the little button in for a couple seconds and then it lights up. And we press it one more time and it starts to vibrate. So we can start working those tight muscles that we might have, say upper trap, you're getting some headaches. So we can take the vibrating ball. Typically I like to get some of these anterior fibers in through here. Working on my breath as well and holding any sort of trigger point. Maybe doing some active release techniques of getting that muscle, getting some blood flow into that area, and applying some self-care to have it release and feel a little bit better. Okay, so if you press it again, it goes to level 2. It's pretty powerful. And then we got level 3, which is even a little bit more power. So for those different levels, I'd say it's patient preference and what you can tolerate. The levels are the same on both. It's just the size is a little bit different. This is nice for travel. This one, honestly, it's small enough it could travel as well. It's different surface area, so the different pressures being applied because it's a little bit more smaller than this one. So patient preference between the two, but nice little tools to have. And the last product that we've been using it with patients at FYZICAL is a Hypervolt. It's a massage gun. Okay, it comes with a couple different heads or units that can be used. We've been using this head, but cool little tool. So I want to talk about how we've been using it, how to use it. So if I come back here, I'm going to show you some technique just on the quad because it's an easy muscle. Kind of share with you, and then I'll go over a couple other muscles as well. But a lot of times we've been seeing individuals using this, jamming it into the muscle and just see what happens. I wouldn't recommend, say you have a sprain or any acute injury, using this on tissue that's bruised, inflamed, red, really swollen. Let's talk a little bit about technique. So to get this guy going, we got to turn it on. We hit button, and there's 3 different levels for that. For this gun, this is level 1. I'm going to use level 1 today on the quad. Okay. So ideally, what I like to do first is work the superficial tissues. And take the quad muscle, all right, and the quad muscle going from the top to the bottom. Ideally, you typically have individuals who just kind of press in, all right, and I want to work the superficial tissues, find any restrictions that might be in that layer, clear that out, and then let's get to the second layer, third, to deeper layers all the way down into the bone. So I'll take the hyper gun, I'll go at about a 30-degree angle to my leg, just so you can see, this is 90 degrees, and here is about 30 degrees, okay? So I'm going from top to bottom, working out superficially, and here I'm actually finding a restriction at 30 degrees. So I'm just gonna hold that area as long as it takes, so until it starts to release and then it starts moving again, right? So I might hold it for 5 seconds, 10 seconds, 30, 60 to 90 seconds, okay? Holding that area until the tissue starts to release, and then the gun will start moving again. So restriction is when I'm moving the gun, it's not moving down anymore. So when I find those restrictions, I hold it in this 30-degree angle, and it's actually starting to move now, so it's releasing. So I'll hold it until that muscle starts to release, and when it does start to release, the gun will start moving on its own, okay? And if I'm finding other restrictions, so clearing out the 30 degrees, I'll go about 60 degrees, getting a little bit deeper layer, finding any restrictions I see, and then as it starts to release, those tissues start to release, the gun's going to start sliding down off of the tissue as the tissue starts to move underneath the gun, right? And then so clearing out to about the 60 degrees, then we get into 90 degrees. And depending on the tissue, so there's a lot of techniques that you can use for this, so I'm showing you some now, but you can also do active release techniques. You can put a muscle in a shortened position, and sometimes it's just what does your body respond well to get that muscle to release and not feel stiff anymore. So sometimes it's even just putting the muscle in a shortened position, and that's what makes it release, or sometimes it's in a lengthened position. But still working on the layers here, now getting into deeper layers. So now I'm at a 90 degrees and I'm getting really locked up in my hip here, and it's not moving very well, so I would try a couple other techniques. One would be an active release technique. So if I was actually in a chair, okay, and just moving my leg forward and back and seeing if that helps the tissue to start moving a little bit better. Even lifting my hip up, let's shorten that tissue a little bit and bringing it down, and that's actually getting that tissue to release a lot better. So great little tool, and there's different ways that you can use it to get your muscles to start feeling more supple, so not as stiff and hard, but they should move nice and fluid. And then once we clear all that out, if you find any tight trigger points you can tolerate, we'll go in there 90 and then applying a little bit of a pressure and just see what's happening. Is the pain increasing, decreasing, staying the same? You know, can we change the tissue? Can we lengthen it or put it in more of a shortened position? How can we get these muscles to start releasing and not feeling painful when we press on them? And another technique is finding that trigger point, you know, holding it for 30 seconds, 90 seconds, 60 seconds until the gun starts sliding off of it. So you can do those types of techniques with any muscle. So you can do your calf muscles, you can do your shin muscles. Okay, you can do these underside muscles, you can hit your lats, some of your rotator cuff as well. Upper trap is a good muscle to hit. You get if you're getting a lot of neck tension, you can go in here working in your neck. I wouldn't put a lot of pressure in through here. I would go more kind of parallel to these muscles. All right, and just letting that vibration reduce some of that tension in through there. Upper trap is always a good one. You can use this down your back as well, working on some active techniques. Deep breath, breathing in through your nose and out through your mouth, and that's getting everything to start sliding a little bit there. So breathing is a great tool that you can use as you're using the Hypervolt, especially when you're trying to reduce tension in the muscles that are related through your chest area. Okay, so that's the last product, and we've been using this at Physical. Great tools. I've been using them myself to really help keep my body feeling good, but nice tools that you can use at home for self-care. If you guys have any questions, reach out to us, let us know. You know, if you're not sure how to use a particular tool, we'd love to help you guys so that you're feeling better. All right, well, thanks for watching and hope to see you soon. Thanks, guys. Bye.